Okay, first, as I walk into the room, I have closed my curtains. Now, firstly, what I do is I wash my hands. Hello, sir. What I'm going to do first is take a look at the room, and I don't see any fall hazards of any sort, and the patient has his call bell within reach, and he does appear to be alert and oriented. So, hello, sir. My name is Hong Yang Lin, and I'm going to be your student nurse today. I'm about to do a health assessment on you. Firstly, could you please tell me your name and your date of birth? Thank you. That's the exact same as what I have. And now, could you tell me if you have any allergies?
Sorry.
No, you don't have any allergies, just like what I have here. Now I'm going to take a look at your wristband, if that's okay. Okay, on the wristband it says Jake Nursing, just like what it says on my paper right here.
As I come in,
So now, firstly, how are you feeling today? He says that he is feeling okay. He is alert, awake. Firstly, I'm just going to check that. Could you please squeeze onto both of my hands, just to see. And what I'm doing, the reason why I'm asking him to squeeze onto both of my hands is I'm just checking for equal strength bilaterally with both hands. So with both hands, he has equal amounts of strength, which is good. And now, is it okay if I try about the same test with your feet?
so first I want you to tell me your name verbally. Jake, that's good.
Okay, could you please push down on both your feet as hard as you can?
That is correct.
Push down on both my hands as hard as I can. Good, thank you. And could you also please push up on my hands as well? Good, thank you. And just for the sake of this video demo, I'm going to assume that there isn't this ulcer on his foot right there. I'm going to assume that he has normally intact skin, just for this video demo. And now, what I'm going to do is I'm just going to check the pulses in your legs and feet, if that's okay. So right now, I check this pulse over here, and there is a full bounding pulse. I'm going to check the one on the other side, also a full and bounding pulse. And now I'll check the pulses on the feet right here. And yes, I do feel a pulse, and I'll check it on the other foot. And I feel the exact same equal pulse. Now I note, as I'm doing this, I note the skin integrity, and that Mr. Jake Nursing, he does have normal skin integrity. His skin isn't abnormally colored. It is warm like normal, not abnormally hot or abnormally cold. So that is a good thing. So now, is it okay now that I will quickly, now I'm about to move on to his chest. I just touched his feet, so I should probably clean my hands again, because I don't want to touch his feet and then touch his chest. So now, is it okay if I quickly inspect your chest area?
So now I'm going to move to your hand.
Thank you. Now, what I will do, so if you look at your chest and abdomen area, Mr. Jake, does it look like it normally is supposed to? Yes, it does. So nothing differs from the usual baseline, which is good. Now I'm going to quickly just lightly palpate your chest area. Please tell me if it hurts anywhere.
May 27th, 2000. Great, that's what I have on my records too. Are you allergic to anything?
Okay, as I palpated, did you feel any? I didn't feel any rigidity or bruising or tenderness. And when I'm looking at it, I don't see any swelling or redness or bruising. Did you feel any pain when I when I touched your chest? No, you didn't? Okay, that's a good thing. He did not feel any pain at all. Now the next thing I will do is I will, is it okay if I quickly listen to your heart sounds?
What I'm going to do is I'm going to get you to grab both my hands.
I'm going to listen to your heart sounds.
Yes, and just squeeze them. Squeeze them and they're equal. I was like, there's nothing weird. In pressure. Great.
And lastly, the apical pulse.
I'm just doing a quick assessment of his face.
Thank you very much. That does sound normal. And now, as for circulation, whoops, I totally forgot. I'm going to actually check the radial pulse on both your arms.
Do you have a headache? He says no. Great. He said, okay, so what I'm gonna do now.
And I note that I checked the radial pulse on both your arms, and I note that they are both equally bounding, which is a good thing. If one pulse is greater than the other, I would find out as to why. Thank you very much. And now I will quickly also check. Because I checked the pulse, I might as well also check the capillary refill in the hands. Yes, there is normal capillary refill in all of the digits. Now, is it okay? I'm going to come to the other side and I'm going to check the capillary refill on the other hand as well. Yes, and there's normal capillary refill, and now I auscultated the heart. Now, next thing I'm going to do is I'm going to just check the patient's breathing. Firstly, I just observe, and what I see is that the patient's lungs, both sides move in and out, rebound up and down at an equally high volume. So that is good. And now, Mr. Jake Nursing, if I could possibly just listen to your lung sounds on both sides, okay? And as I remembered, when I palpated his chest, he didn't feel any pain anywhere. Now I'm going to auscultate his lungs on both sides, starting from the very top, which is like about up here. And please, every time I place the stethoscope, please breathe in and breathe out fully for me.
Do you have a family history of any chronic illnesses? Do you have any chronic illnesses? No. That's all good. And now what I'm going to do is I'm going to assess.
So if you have any questions, let me know. So now I'm going to do another safety check as an exit. 12 bells is at reach, the patient is comfortable, is lowered, no safety hazards, do hand hygiene, and
Also going to check his
everything that
pulse.
I've done. Thank you.
So you can refer them back to any of these if there's anything.
Did I forget anything?
Okay, when I heard Mr. Jake Nursing's lung sounds, what I noted was that everything was everything was normal. I didn't hear any crackles or wheezes at all. So that is a good thing. You do have normal lung sounds.
And I'm just going to check his arms.
And if it is all right, now Mr. Jake Nursing, I'm going to have you sit up. I'm going to assume that Jake Nursing just sat up, and I'm going to be looking at his back. So I'm going to be looking at his back, and I'm going to assume that this is his back.
On his arms looks good as well.
On his back, I see that. Please inhale and exhale. Both sides are going, both the left side and right side are going up and down equally. And now, is it okay if I quickly palpate touch your back as you breathe in and out? I'm assuming this is his back. Please breathe in and breathe out. Good, thank you. Please breathe in and breathe out. Thank you. Please breathe in and breathe out. Thank you. And now what I will do is if it is okay, I'll place my stethoscope on you and listen to your lung sounds again as you breathe in and breathe out on your back. Once again, assuming this is his back. Okay. Please breathe in and breathe out. Good. 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 Please breathe in. Breathe out.
When was your last bowel movement, Mr. Nursing? He says this morning. So do you have any bleeding when you're having a bowel movement? Does everything look normal? He says yes.
Thank you very much.
Are you eating regularly? He says yes. And do you drink lots of fluids? He says yeah. How's your urination?
Thank you very much.
He says
Whoops.
it's good.
Oh, I forgot. I forgot one of the first things I was supposed to do. I did ask him his name and date of birth, but now I need to ask him if he Mr. Jake Nursing, do you know where you are? And which is the hospital, and do you know what date it is or what day of the week it is? That assesses his if he is confused or disoriented at all. Now, as I look at him, he does appear awake and alert and oriented. I'm just going to ask, do you feel any right now, how are you feeling? Do you feel any headaches or do you feel any dizziness? No, he does not, which is a good thing. Now, if it is okay, I'll quickly assess your bowel sounds. So I'll be looking at your torso from this point. Sorry, now I'm going to quickly go over to that side. So right now, first as I inspect the bowel. So, Mr. Jake Nursing, have you been urinating regularly and having bowel movements regularly as normal? Yes, you have, which is a good thing. Okay, now as I inspect his abdomen, Mr. Jake Nursing, do you feel any abdominal pain? Do you feel full or uncomfortable in your bowel, in your abdomen anywhere? And does it normally look like this? Yes, it does, which is good. And for the purpose of this skills demo, as per what the course instructor said, I'm going to assume that this is not here. Assume this doesn't exist. And now, what I will do is I will auscultate and listen to his abdomen for any bowel sounds. And what I heard were normal bowel sounds, and there was no absence of bowel sounds. Everything sounded normal, and now, is it okay? I will now touch your abdominal area. Firstly, when I looked at it, I don't see any sort of contusion or swelling or bruises of any sort. Now I will palpate it. From when I palpated it, I did not notice any rigidity, any sort of tenderness. And when I palpated it, did it hurt anywhere? No, it did not. Okay, that is good. Now, nextly, I will quickly take a look. Mr. Jake Nursing, are you currently using a Foley catheter or a condom catheter of any sort? I'm going to look at the sheet, the patient log, and see that there is no Foley catheter. Let's assume there is a Foley catheter that he is using. If there is a Foley catheter, I would inspect the Foley catheter. And what I would see is I would take a look to see if there's any sort of abnormal drainage, discharge, or purulent discharge on the Foley catheter. And does your urinary tract hurt at all? No, it does not. Okay, that is good. I'm assessing. There seems to be normal skin integrity. Now, lastly, I've just assessed the CNS, CVS. Lastly, I'll assess your integumentary system. Mr. Jake Nursing, I'm just going to quickly take a look at your skin, if that's okay. I'm going to take a look to see if there's any sort of cuts, bruises, or anything, okay? First, I'm going to take a look from the head to the toe. I've already looked at the chest and abdomen, and I noticed there was normal skin integrity. And I also did look at the back because I auscultated the lung sounds from his back. So all that is left is his head, arms, and legs. When I look at the head, I also have my pen light on me. Oh, I forgot. I'm going to quickly just shine a light on your pupils, okay? And quickly take a look if both of your pupils are equally reactive to light, if that's okay. I'm shining a pen light. And both of his pupils are equal and reactive to light. Now, what I will do is inspect the skin on his head. Everything looks normal. There's no damaged skin integrity. Does it hurt anywhere on your head? Or are you having a headache of any sort? Or any dizziness? No, there isn't? Okay, good. Now, next I'll inspect the arms. As before, I have already checked his capillary refill on both his arms for all the digits, for all the fingers, and I've also checked the radial pulse. Now I'll just do a quick inspection and palpate his arms to notice if there's any. Does it hurt anywhere when I press on your arms? No, it does not. That is good. Now I'm gonna try the other arm as well. So, the other arm, I've also already, as from before, I've already checked his capillary refill and his radial pulse. And his cap refill and radial pulse were both normal and equal on both sides. Now I'll just take a look. And let's assume that this doesn't exist. So nextly, I will quickly just palpate. And please tell me if it hurts anywhere, okay? No, it does not. Oh, I totally forgot. I checked his radial pulse on both sides, but I might as well also check the brachial pulse on both sides, which is right here.
Doesn't matter. I was gonna print it.
Yes, there's a presence of a brachial pulse, and I'll also check it on this side as well. So the brachial pulse on both sides are equal. Thank you, Mr. Jake. And now, lastly, now, is it okay if I inspect your feet and legs? Yes, it is? Okay.
Yeah.
Up to here, and what I noticed is for his feet and legs, I have not yet checked the cap refill for both of the feet yet. And just for the purposes of this video, we're gonna assume that this damage doesn't exist. I'm checking the capillary refill.
Remember when you're using the wipes? I don't think I said this to you. You want to wear gloves with these wipes. This.
And also on this side as well.
We're gonna stick to this, but this one.
Good, and the capillary refill on both feet are equal. And now, is it okay? I quickly inspect his skin. I don't see any varicose veins of any sort. I don't see any bruising, bruising or swelling or any fluid buildup, edema buildup in his legs either. Now I'm gonna check the popliteal pulse on this side. Good, and now I compare it with this side. And both sides' popliteal pulse were equal. And at the start of the video, I've already checked the pulse on here, this pulse and this pulse on both his feet at the start of the video. And I noted that they were both equal. It doesn't hurt in your legs anywhere at all? Does it hurt anywhere in your legs? He tells me it doesn't. Now I'm just gonna lightly palpate your legs to feel if there's any pain, okay? So do you feel any pain anywhere? No, he says he doesn't? Okay, thank you, Mr. Jake Nursing. I'm going to put your blankets back on, and now, and that is the end of my head to toe assessment.